Okay, so this brief video is intended to take you through family and group therapies and their main features, especially ones that you might want to be aware of as you're preparing for your unit test on psych disorders and treatments. So family and group therapies can take a wide variety of forms, meaning you can use almost any of the forms of psychotherapy addressed in your textbook in a family or group setting. The reason that someone might choose to use a family or a group setting for psychotherapy typically involves the unique benefits of that setting. So, not necessarily a specific theory, but the recognition that there might be some benefits that patients can receive in a group setting that they can't access in one-on-one psychotherapy. For example, a lot of treatment groups, clients who encounter them appreciate the feeling that they get from being with other people who have their same condition. So maybe a support group for folks with OCD, or a group therapy for folks with OCD. People with social anxiety might find it beneficial to do psychotherapy in a group setting because they might recognize that they're not the only one that has their problem. A lot of people that have been struggling with a psychological issue or disorder for some time, although these things are not just used in treatment of disorders, but also shared conditions like maybe folks who have experienced a recent loss, like loss of a spouse, maybe support groups for people whose family member has a substance use disorder. It is helpful for them to recognize that they're not the only one going through those struggles, that other people not only have experienced those struggles, but also are at various points in the process in overcoming them and may have some fresh ideas that might be useful to them as they are going through the same process. It also, especially family therapies, have the benefit of helping the person maybe who's central to the disorder. If there is one person who's suffering from psychological disorder, I'm thinking, for example, here, a patient, like adolescent patient who has an eating disorder. She may not be completely aware of the fact that her behavior is having real impacts on other people in the family. And that those family members also might not have a clear recognition of how their behavior might be indirectly and unconsciously perhaps supporting the behavior of the person who's suffering. So having everyone kind of be aware that they're interconnected and that no person is an island is a real benefit of family types of settings. So the methods will vary depending on the type of theoretical orientation of the person leading the group. Oh, and that being said, some group therapies don't even have a trained leader or practitioner heading them up, like self-help groups like Alcoholics Anonymous or NA, Narcotics Anonymous, are groups where maybe there isn't someone with professional training, but maybe just someone who's a dedicated volunteer who's helping organize the group. So they may not come to this with any particular theoretical orientation. But regardless of whether it's led by a trained professional or not, obviously this is going to involve meeting in groups to discuss progress, maybe participate in exercises so that everyone can get feedback from each other. Turns out for folks with social anxiety disorder, these kinds of groups can be especially important because they can help people practice introducing themselves, or dealing with awkwardness or discomfort, or having to confront or someone or ask for a favor, or doing a public speaking kind of exercise. Like all of those things can be done in a group, and then the person is practicing them in a safe setting before they actually have to encounter that stuff in the real world. As I mentioned before, family therapies tend to emphasize a lot of interconnectedness. So by meeting with the entire family or family unit, you help the person see how their actions might affect other people, and to help them check their perceptions of other people's behavior. Maybe how one person was interpreting a conflict is not how the other person involved in the conflict was interpreting it, and that's leading to and continuing the problem. So pros and cons for this. There are obviously some unique benefits to these types of settings that cannot appear in, or cannot easily be recreated in one-on-one psychotherapy settings. There usually best suited to a particular narrow issue. So, for example, a group that's offering support for folks with a recent diagnosis of OCD um, is probably going to be most helpful if everyone is just focused on the OCD in that group. Although, obviously, any single one of the patients also has other issues going on in their lives. Um, let's see, I'm trying to think of other examples where that might be the case. So for example, if someone's going to their AA meetings, the entire purpose of that group is to talk about problems in overcoming alcohol addiction. It's not really meant to be the place where people also address other things like maybe depression or a different type of chemical dependency. So while the focus on that issue can be helpful because it helps people address the topic that they want support on, it also might be not the best for someone who's got, or it might not be enough, I guess, for someone who's got a wide range of issues. So they may have a substance use issue, a mental health issue, is struggling with a relationship problem. A single group setting probably may not be able to address all of those things. And of course, because you're meeting in a large group with and you maybe only have to pay the practitioner for that single hour of service, this can be a more cost-effective way to do some types of treatments. That's probably never the first reason that you should embark on group therapy, though. Because it's cheap, you wouldn't want to do a psychotherapy that otherwise is counterindicated just because it's cheap. So that's not the primary reason, although it can be kind of an ancillary one. And of course, this is not for everyone or every type of problem. Some types of issues might actually do worse in group settings. It's hard to imagine a group devoted to treatment of narcissistic personality disorder, because folks with narcissistic personality disorder tend to have very inflated views of themselves and they want other people to praise and give them a lot of attention. If you have a whole room full of people doing that, it might be very hard to focus the group appropriately, and people might not get out of it what they want. So it might be kind of a disappointing experience. So some types of problems might not respond as well to this, is what I'm getting at. Some that do, we definitely know people benefit from support groups and any kind of group setting if they're going through a new thing in their life that they haven't experienced before. Losses, chemical dependency problems, a struggling family member. Group therapies seem to be especially effective with veterans in treating PTSD. They're very effective, and perhaps the most effective way to go about providing support for social anxiety disorder. So very effective for some things, not effective for all, which seems to be the case with a lot of our psychotherapies.